Okay, hi Shameless Squad. It's me and Poiab Vue. We are back today, talking round two about a topic that is near and dear to our hearts. If you are new here, hit subscribe below. Be a part of my Shameless Squad, yo. And the shameless truth that we're talking about today is therapists getting taken advantage of. So we were discussing, therapists. We don't typically get taught things in business, and people want to really like siphon and suckle off of therapists' money, their energy, their time, and use them and abuse them and not pay them for certain things that are really truly fucking important and near and dear to those therapists' hearts out there. As well as there are therapists in the field that will also try to use and abuse therapists and not pay them for consultation or coaching or whatever if they are going into their own business. So this is the shameless truth. So we're going to spill the tea. Haya, what do you want to talk about first with this, and what's important for people to know about when it comes to taking advantage of the therapist?
Jackie, I'm glad we're talking about this today because, like you mentioned, we don't get business like training. So a lot of us have been taught to do things, out of the goodness of our heart. And because of that, we get taken advantage of, especially in business. And we are a profession that wants to give and give and give. And we feel guilty when we have to take. It's not even about taking, it's really about putting worth and value in our knowledge and skills as therapists. And, like you said, shameless truth, we have to start advocating and standing up for ourselves because otherwise we will be taken advantage of by other professions and even our own profession who refuses to see our worth and value. And we have to advocate for ourselves. So I'm glad we are talking about this today, Jackie.
Yeah, I love that you said all of that. And one of the ways that I know I've personally had to advocate for myself to not get taken advantage by therapists in the field who've seen me and seen my website and my content and the copy that like I write and how I sell and what I do. A lot of them have been like, oh my God, I would love to pick your brain. And I'm like, no, that's a shame narrative. That's an abuse cycle. And it's in our field. And I'm just like talking out about that and telling people like, you can pay me for a consultation, or that's a coaching package. That's too much for me to like answer all these questions here and not actually have consistency with movement for people like even opening up their own businesses as therapists. And I think sometimes therapists, you'll get a couple different answers with this, right?
Yeah.
You'll get the ones that'll be like, I didn't realize your rates were that much, or I didn't know it was this expensive, or like some of them, I give credit to these ones out there, actually come back around and apologize and shamelessly own their shit. Like you say, own it. Like people, some therapists that actually get into the thick of it and creating their own business, they're like, oh my God, Jackie, I'm so sorry that I ever wanted to pick your brain. I realize and see now, and I've learned from you how and why you have set so many boundaries, especially when you invested in your own coaching or your own education or your own mentors. And that's one of the biggest things, like shameless truth for therapists out there that are looking to open their own business. You need to do that too. And you need to take that route with someone that you are inspired by, knows your fucking ethics. I don't recommend working with a business coach. Work with a therapist who is a coach because they know what the hell you can and can't do in your business too, girl. And so that's just my shameless tangent there. But I want to ask Kaya, like, would you be willing to share with everybody about the post that you wrote on LinkedIn the other day? Because I think that's a big one when it comes to some of this that I think could be good to just put out there again for people.
Yeah, thanks for bringing that up, Jackie. So I recently wrote a post right before I came to Bali, caused a lot of chaos, and I'm like, I'm going on vacation, so it doesn't matter. Bye. So, but yeah, I was just at home writing, and I'm like, I'm going on vacation, so I'm going to be very honest, shameless, own this, post where I just really wrote from my heart because I had a few companies and agencies and people who were asking for my professional feedback about certain things. And I wrote back and said, you know what, this will be a great partnership. If you would love to do consulting with me, I would willingly answer these questions for you. And I got nothing back. And I thought, wow, they wanted to use my professional expertise about a product that they wanted to sell or services that they want to sell. They wanted to use my skills and my knowledge as a therapist for their own well-being. And I thought, would they have approached a doctor, a lawyer, engineer, or any other profession with this kind of approach? And I think no. And so I just sat down, I wrote about it, and I was very honest. And I said, they say there's a mental health shortage, and somehow that's our fault that there's a mental health shortage.
Yeah, no.
And it's not our fault. We have a shortage of mental health therapists who are sick of being taken advantage of and sick of the bullshit, and they're saying no, we're not going to be taken advantage of anymore. And so I wrote a very shameless post saying we're not going to be taken advantage of anymore. We are worth it, and we got to own our worth. And you may think you're giving us a great opportunity, but we see through it. We're not naive. We see through that you want to burn us out for as little as money as you can give us. And sadly, it's sometimes a lot of it is other therapy companies, it's tech companies, it's big organizations who want health and wellness but won't invest in a mental health therapist, but want to take a shortcut by getting a coach or a lawyer or someone who's a very mental health advocate, which is great. Having a mental health advocate lived experience is great, but when you need someone who actually has a professional experience, they're not willing to pay us for what we're worth. And I got sick of that, and I said, you know what, I'm going to speak out about it. And I'm glad I did. And Jackie, that post blew up. I didn't think it would blow up. I
knew it would. I've been telling her in different things. She knows what I've been telling her.
I was just like, you know what, I'll just write this and get going to Bali and be like, peace, y'all. Mm-hmm. And yeah, it got so many reposts.
How many posts and likes and comments,
I think it got over 1,000. The most I ever got was 100 when I, again, spoke out about something. It seems like when I speak out truth, a lot of people like it and other people don't like it. And I knew that writing that post, I was going to get likes and dislikes. And I'm okay with that because I knew that I was speaking the truth. And people in our field, we've been taught not to speak the truth. We tell our clients to advocate for themselves, to tell the truth. And yet as therapists, we can't even do that for ourselves.
Right. And I think it's not that we can't, it's that we won't, and then we hold ourselves back, and then we self-sabotage and we shame ourselves.
We do. Whether or not
we even know it. And you and I talk about this a lot, about how we have a lot of work to do on ourselves as therapists in the field, especially with these shame cycles that just keep going and going and going, that we have to accept the bare minimum. And what I loved about your post was like, they want to pay, supervisors, for example. Mm-hmm. You've been seeing ones or people have reached out to you, correct me if I'm wrong, like, oh yeah, we'll pay you like $80,000 or $75,000 or $60,000 to be a supervisor. Yeah. And that's working full time. For those you don't know, if you're a supervisor, you're working 40, probably 60 hours a week. Yeah. You are working with pre-licensed clinicians to help get their hours, to help them diagnose, to help them with treatment plans, to help them with goals, to help them log everything, sign their shit, make sure what they're doing, like everything right. It's a lot of extra work and energy. And so a lot of supervisors, unfortunately, get burned out and burned into the ground. So was that kind of the ranges that you saw? Was I wrong?
Yeah, like 60 to like 85,000. You would be lucky if you saw 90. Honestly, with that kind of work, Jackie, you should be getting paid over $100,000. Any other job, you'll be getting paid $100,000. Yet therapists, we are so underpaid and we're so burnt out. And this is why a lot of people are leaving the field,
or going into their own private practice, or just seriously doing coaching because they've been here, done that, got the t-shirt, and they're like, I don't want anybody to tell me what the fuck I can or can't do in this company. And quite honestly, like being a supervisor, you're doing 2 to 3 jobs, like in one, depending on the supervisor, because sometimes they will be a supervisor not only to their pre-licensed clinicians, they will still seek therapy clients, they will still provide consultation, and they will still also have to sign off on notes and do admin. And some of them at certain types of companies and agencies and settings are also the clinic directors. And sometimes people are like, I tell that I tell people this, I'm like, if you want a very healthy therapist and be in a healthy company that is going to treat you right, like VIP status therapy, they're going to remember you, they're going to remember your friend's name from that one session months ago, they're going to be able to help you and be present with you, then private pay all the way, because this insurance does really kind of have this rotating revolving door, and they push so many people on therapists and also supervisors who might be at the top of the company, but then they're projecting and passing down that complex trauma of being burnt out, overworked, overburdened, and also you don't know what their mental health diagnoses are either. Like therapists have them too. And even if they don't, they have mental health, and that's important as well to take care of. And I think in your post, you wrote something like they want the Ritz-Carlton of therapists, but they want to pay them shit for pay. So I'm like, well, if you are doing 5 of those jobs, or even 2 of those things that I mentioned, why aren't you getting paid $250,000 by these companies?
Exactly.
And it's because a lot of that money, unfortunately, does go to the higher up administration and the business people and the COO, the CFO, the CEOs. And that's how therapists get taken advantage of. To Paida's point, that's why people leave, because a lot of times the split of how much therapists make don't go up. If you go on for extra certifications or things like that, coursework, some of them don't care. And depending on what types of therapy you're doing, you could be getting paid lower rates if you are getting paid for family therapy or couples therapy. And some people don't do that because it's a lower rate and they need money in order to, survive. And it's sad because a lot of therapists in those settings are really in survival mode because of the use and abuse and the cycle of it.
Yeah, exactly. And you and I talked about this. Unfortunately, you get what you pay for.
Yeah.
And if you use your insurance, go ahead. And likely your therapist is seeing 8 clients a day. So
sometimes 10 to 13.
Yeah, sometimes 10 to 13, and you're not getting the best of the best. If you want someone to remember you, show up on time, remember what you said last time or the names, you're probably not going to get that with a therapist who is overworked, who is burnt out, who is just on survival mode.
Underpaid.
And you're going to notice that I'm telling you these things as a client and you're not paying attention. And yeah, those are likely the type of therapists that you're going to get. So unfortunately, you get what you pay for.
Yeah. And that's one of the things that, like, me, like with family and friends, I've been so fucking shamelessly honest with them of like, if you're going to actually ask me, and this is another way therapists get used to that I just thought of off the top of my head. Like family members and friends will use us to try to figure out how to seek therapy or counseling. And we will give them all the information. Like I've been on the phone for hours sometimes with people discussing this with them. And if they do take the steps, they don't take the steps, whatever, they're figuring it out and they just don't want to talk to me about it in the future. Fine, cool. Yeah. However, like pay that therapist or do something for them, and that hour or two, they just try to even help you with this and even explain what your options are. And I have been blue in the face when it comes to people and saying like, if you want a really good therapist that's going to be present for you, show up for you and there for you, and there's more confidentiality and you don't have to worry about like your work getting in these files or losing your job or your career, because that can happen with insurance, everybody. Like employers, can ask for that information. It's whether or not you sign it over, right? You do you at the end of the day, boo. And like, I've heard so many people when they don't listen to me and my shameless truth of, if you're willing to pay for a doctor out of pocket, a dentist out of pocket, a chiropractor out of pocket, a naturopath out of pocket, a trip to Bali out of pocket, a new car out of pocket, a kid that's on the way out of pocket, you just got a new puppy out of pocket, and you aren't willing to pay for a mental health therapist or a counselor or therapy just in general, but you are struggling to live your best life, there's some red flags that you have to check in with yourself. You have to be able to plan for therapy at that point. And sometimes it comes down to priorities, but then I hear people coming back and they're like, I wanted to prove you wrong, Jackie. I really wanted to be the person that found the insurance provider and told you, I got one. And no one has ever said that to me. They want to come bitch, they want to come complain, and they want to say this was my experience. And I just say, hey, this is something that I wish you found that, insurance provider. Truly, I wish you told me I was wrong and that you found somebody that was absolutely fantastic, phenomenal, and they will be your therapist for life or however long you need to see them for, right? But that has never happened. And so that just shows red flags versus green flags too of yourself, your priorities, whether or not you're willing to pay for therapy versus, other areas of your life. And like, if you're not prioritizing your mental health, and if you don't have your mental health, what do you have? And if you are out there, because I know I have some coaches and people that are in my network, if you are willing to pay a coach out of pocket, but you're not willing to pay a therapist out of pocket, and you need to be working on mental health symptoms and really some attachment wounds, things from the past, trauma, complex trauma, shame, depression, anxiety, like mental health diagnoses, some pretty heavy stuff that could be challenging. Healing from infidelity, an affair, whatever, right? Like, and you're not paying a therapist for that, then I just hope that this challenges you to really think that through and hopefully revamp your priorities and reshape your priorities. Because at the end of the day, if you find a therapist out there that you know, like, and trust based off of their content, their articles, the things that they've put out in the world, their books, right? Mm-hmm. And you're like, I'm going to save up to pay for them, or I'm going to figure it out, then you will. Mm-hmm. And that's one of the biggest things where a lot of people will shame private pay therapists out of pocket and think that, oh, you're just using and abusing clients, or you're just helping the rich. I'll let Poiab speak to that one a little bit more. It's really like, no, there's a priority in this of mm-hmm. people that care enough to budget and plan and use this moving forward. And a couple tips before I pass it back to Poiab, I'll be done in a hot minute. I get passionate. You know, look at your HSA or your FSA. If you don't have one with your insurance plan, get one. You can use that for therapy. Therapy budget right there. If you want to go back and watch my old video about 8 ways to pay for sex therapy, it applies to therapy as well, out of pocket. Go do that. Be on a PPO plan. Don't be on an HMO plan. PPO, you can use out-of-network benefits. That therapist, they can, if they want to, write you up a super bill. Everyone is different, so you need to talk to that therapist. But you are in charge of knowing what your insurance does and doesn't cover. You are in charge of knowing if you have an HSA, FSA. And, you know, get creative. You know, can you pick up some more hours at work? Can you do another shift? Can you sell some things? Can you ask family members, you know, can I watch your kids for the weekend? And in exchange, like, for that energy and that time, you know, will you pay me X amount of dollars because I want to be able to save up for therapy? You know, shit, like, I'm not married. I tell Pi, I think I've told you this, but I was like, if I ever do get married and my partner right now, who is a therapist, if we ever, like, we need to go to couples therapy and figure our shit out, right? We're going to have a therapy budget for, like, I wouldn't register. I told him I don't want to register. Who knows if he'd ever watch this. And he knows that. But I was like, it would be better for us to have a couples therapy budget because why aren't we prioritizing the health and the wealth of our marriage? Okay, mic drop, you go.
Yeah, thanks for all of that, Jackie. You know, and I know this is hard for people to hear, but it really is all about priorities. In my work with people, a lot of people mask their challenges and issues by buying houses, cars. I love vacations. We're here in Bali. And, you know, sometimes people use vacations as escapism. And it's like, you know, sometimes that money could be used for your health and wellness so that when you do go to a vacation, you're not coming back to chaos. You're coming back to a life that you love and like. So, you know, and I'm trained in social work lens, and we're very social justice. And with that, I'm going to say this, other therapists, other social workers may disagree with me. There's a lot of shame of how we've been trained, because we've been trained to really help and advocate marginalized communities and populations. And so the thought of private pay is very shaming. And so when I opened my private practice, I had a lot of other therapists who were trained in social work lens, being a licensed independent clinical social worker, that shamed me for being private pay and said that I was only working with rich white people. And so that was the assumption that only white people were rich, and that other people, you know, other communities did not have money. And so I got shamed a lot, and luckily I worked in my shame. And the most supportive people of me becoming private pay were my clients, who said, Poiab, good job, congratulations, you do what is best for you. And that was so heartfelt. It was other therapists that shamed me. So does that surprise you at all, Jackie?
No, it really doesn't. And just for everybody who watches this, do you work with a lot of BIPOC clients?
Half my clients are BIPOC. They are millennials and they're Gen Zs.
Right there.
Right there.
Literally. I think that's so important to just for context and just to know, like, literally there are young, wise people out there, you know, prioritizing their mental health, everything like that, and knowing, like, I don't want to do things maybe the way my parents did. Maybe, you know, the way I see these other things going on generationally, like I'm going to be different. I'm going to work on myself and my wellness and just even like work through some of these things with you.
Yeah.
And, you know, I've worked with a lot of, you know, trans and non-binary folks. And that's one of the things in like the sex therapy industry and realm that people will really say they don't have money. How are they going to do this? And I'm like, no. And there's been other wonderful, you know, therapists out there. Shout out to Ellie Tripp if you ever watch this. We had a beautiful conversation about how there's all these stupid stereotypes and how, like, even in the sex therapy, like, niche of therapy, some people just think that. It's like, no. Like, we got to get these narratives out of our heads and start talking about these things really shamelessly and say, that's not cool and whatever. The part around like people with lived experience, absolutely, with like, you know, it's great to have mental health advocates in these different company settings, whatever. However, they would not be able to do that without therapists. And this is a post that I wrote previously. I got a lot of likes, whatever. And it's also like, I did it during May Mental Health Month. And I really talked about how about you start paying therapists to come in and speak? Because we are the ones that have studied. We have 8+ years of education, or 6, depending on how fast you were with your education. Me, it was 8. And for some people, it could have been longer or shorter, but we're consistently doing the, you know, we have the lived experience as therapists. We also have the learned experience from our client, or from the education, and we have the heard experience is what I always say. It's 3 things. So it's like, that's the trifecta right there. It's like you want the singer, dancer, actress of a therapist, then hire a therapist or a person that's going to be coming in and talking about mental health, hire a therapist to do that then. The other part that I wanted to shamelessly share was you and I talk about privilege a lot.
Yes.
And one time I said to you, sometimes we choose our privilege.
We do.
And therapists, we also do choose our privilege if you want to be on insurance. That is a privilege. Because insurance is, for those that don't know, depending on how full the counties are, they will say, no, you're cut off. We don't need any more therapist providers in this area. And it's also a privilege because you have a guaranteed income that's coming in every 6 to 8 weeks if it's backed up, or so often. Every insurance plan is different out there, right? So there is a privilege in being insurance based too. And that's one thing I just wanted to talk about. Right? But the thing is, yes, there is a privilege in being private pay. It is one of the harder routes to actually do it because you have to work on yourself mentally, emotionally, spiritually, financially, physically, psychologically, everything. And it's not the route for all the therapists out there because it is that much harder to actually take the steps to do it, in my humble opinion, quite frankly. And I wrote a different post prior to the one in May, mental health. And what was I writing about? But I got trolled. I got trolled by my cousin. And I got trolled by white therapists. The BIPOC therapist had my back in the post. Do you remember what I talked about?
I think you talked about like private, definitely something with private pay. I don't recall, but I know that you got trolled.
I was talking about how a lot of people need to work on their scarcity mindset.
Oh yes, your scarcity mindset.
Being private pay, or not actually thinking they can afford things in life when they actually can. It's just whether or not they choose to afford those things. And what I said to Poiab once was like, we choose our privilege. And that went back to this conversation. I got trolled, and I got trolled by a cousin of mine who was older and white, and I blocked her. I got trolled by a couple white therapists who thought they fucking knew me because I put do better at the bottom. And unless you follow me on Instagram, I don't always post to my Facebook, but my Instagram, earlier this year, I was like, flow don't force is an intention, do better for like myself and others. And like, we can all do better in this world. And then there was a third word that I had for this year. I don't remember, but I was basically sharing that from a motivational stance. And so it's one of those things where people just want to be quick to judge and shame when they don't even know you. I'd be friends with you on these different like platforms and stuff, but they just want to come at you. And so I had a lot of trolls that were white women therapists. But guess who had my back and stood up for me?
The BIPOC?
All the BIPOC women therapists.
Were you
Does
surprised?
that surprise you?
You know, I'm not surprised.
I'm not. No.
I'm not surprised. Yeah, most of my most biggest supporters have been other BIPOC women therapists, and somehow that's surprising and not surprising. I think a lot of people use the advantage of us being BIPOC almost in a shaming way because we are BIPOC. We are expected to give ourselves more to serve our community and other people who've been marginalized. And when we choose ourselves and our well being, not everybody likes that. And yet it's been the BIPOC women, therapists, professionals, businesswomen and say, you go, Paya, you do this, you deserve this. And it's been the white women therapists that have really shamed me. And you and I talked about this, and I said, Jackie, why is that? And I'm like, what is going on? Like, why is it the BIPOC therapists, women therapists, that are saying, you go, girl, you do what is best for you? And it's the shame that I get from white women therapists.
Yeah. To give you context, Pay was like, you can tell me to fuck off if this is not like a good subject to talk about. I'm like, no, I'm always open to discuss this.
Yeah.
And I was like, truly, I think it's because white women are in a power of privilege and they choose to not use their privilege for good. They choose to maintain this level of power, I feel like, to feel like they have some superiority, and then to maybe cling on to other people in power and privilege so they don't have to crumble. And again, I think that's a lot of I've seen that too from white women therapists. When I opened up my business, a person that I was like doing a coaching program with was my buddy in this program, and she was like, oh yeah, like there's all these pre-licensed therapists like charging $200 an hour, blah blah blah. And I'm like, well shit, like have you seen my website? Like I charge more than that, right? Like I charge $227, which is what my business needs for individual weekly sessions, more for the first appointment and for longer sessions, of course.
Yeah.
But that's because like it's also based on a plan. But people just want to assume, and they think, wow, you're pre-licensed, you don't know shit, or you don't have life experience. And then there's all these other, you know, shame-isms that come in with that. Not just racism, there's also ageism that comes with that. And a lot of people will look at me and my website and they'll be like, does this girl know what she's talking about? And then they actually work with me and they're like, damn, you're a wise soul. Like, you don't play, you set your boundaries, you have fun in therapy, and you also bring us back to what I was talking about. Like, you were just so present with, if I go from here to there to here, you're like, rewind. That's what I try to do. So I think it's important to, let me rewind myself for a moment. I think it's important for white therapists to really check their privilege that they have in the field. And there's a lot of harm that can be done, and there can also be a lot of harm that can be undone. Or like things that can be repaired with people as well in these attempts. So
thank you for saying that. Thank you for saying that, Jackie. And it was very brave of you to say that too, knowing that there will be some backlash. But you know, we're being very shameless and we're calling out things for our, and there is definitely privilege in what you said about using that privilege and not wanting to. Do you feel like they don't want us to, like, you know, be up there too, or do you think it's just very isolating, or what do you think it is?
I think they're threatened because nowadays people have more autonomy over who they can choose as a therapist. You want a black therapist, you can choose a black therapist. You want a trans therapist, you can choose a trans therapist. You want a Hmong therapist, you can choose a Hmong therapist. You want a 22-year-old therapist, you can choose a 22-year-old therapist. And so I think there's a lot of potentially therapists that have been in the field for longer that don't want to change, and because of that, and when you are in this field, you basically sign a deal of like, you're a forever learner, you are going to have to advocate for yourself, and you're going to have to advocate for this field. And I think if people don't do that, the ones with the most privilege and power, it sets back the women's movement, it sets back where we are in 2024, it sets back the ability to be able to choose even therapists. Like, I see it all the time too, where people are like, I want a neurosexy, I call it neurosexy, neurodivergent therapist out there, right? To not just judge me and shame me, and they just know how to work with me. And I think that scares people because people are becoming more open and vulnerable around mental
Yeah.
health, and the stigma is still there, but I think it's slowly going away. And I think if, you know, these people don't live up to maybe being perfect or having this facade or a mask like we see clients do, therapists do that too, y'all.
Yes,
Therapists are not
we
fucking
do.
perfect. I'm not perfect.
I'm not either.
And so I think that's a big part of it. And so I think with why I wanted to write the post around scarcity is that a lot of therapists sometimes do think there's not enough clients, there's not enough clients, there's not enough clients. Well, there are enough, and the clients that want to work with you will find you.
Yes.
And so that was like me just trying to share a shameless truth, and I was like, shit, okay. Clearly, this got some people triggered, and it's not about like me. It's about them not doing their work and projecting, you know. And I think it's great that people have so much options out there and choices with who they want to work with. I mean, that's a beautiful gift when it comes to picking more therapists. And I said that too. I was like, BIPOC therapists need to be the ones that get paid fucking more, if anybody. Because honestly, like, they're the ones with wait lists. And they're the ones that have lived through so much more trauma than maybe the average white therapist. Obviously, everyone's different. Everything like that. Different. And I think there's a lot to be said there that we just glimpse over and we don't always talk about, even in graduate programs with cultural competency and different types of things. So thank you for saying that, and everything you said was right on, just right on. So I appreciate that coming from you, just being very honest, shameless self. And you know, I wonder if I were to say that, would the response have been different or would have been the same too? I think it would have been different. Yeah. You and I talk about this. Yeah. And it was like, should I for fun take Poiab's LinkedIn post that we talked about at the beginning around being used and abused as therapists and stuff, right? And should I type it into ChatGPT and do a fun little experiment and see if I get the trolls? Because who knows, right? Yeah. Because I think people see me and they're like, oh, poor little white girl, like therapist. And it's just like, no, it's like, I'm just really trying to call this shit out like anyone else. And like, why aren't more white therapists doing that? Yeah. It's because of the power. I don't think they want to lose it.
Yeah. Yeah. You know, and yes, there's certain privileges that white therapists have. Absolutely. And I also want to call out that I do have some privilege too. And honestly, I think it's because I wrote it, being a BIPOC woman gave me a lot. People were willing to hear my perspective as a woman and as a BIPOC versus someone probably like you. It probably would have unfortunately got a lot more backlash. Since I wrote it, it was more like empowering. And so I admit, like you and I talk, we all have certain privileges, and society may not see me as someone who has a lot of privilege. And yet I do admit I do have a lot of privilege, and I'm using that to speak out and use my voice in ways that other people probably don't feel comfortable with or don't feel like they can do this. And I'm just going to call it out for what it is, and I'm going to use my privilege.
Absolutely. So anything else to add on this one that we're talking about, like how therapists get used, abused, privileged, just putting things out there, having some real honest conversations about different types of privilege, choosing it when you're in the field as well?
I just think that as therapists, we have a long ways to go to really advocate for ourselves, work on our own shame, work on our own trauma, and really work through what we have to, because we do deserve it, therapists. We got to own our worth and our value, because if we don't own it, we will be taken advantage of, especially in business. We got a lot of skills, we got a lot of knowledge. People want to use that and also pay us the least. And we got to remember, we have it all. We got to charge our worth and own it. So
yes, I love that point. One of the things that Pay and I will talk about a lot, is it okay if I share the thing about lawyers? Okay. Yeah. About like how there's lots of lawyers out there that will talk about relationships and all these different types of things. And it's like, where did you study relationships? Yeah. And Mel Robbins, actually, shout out to you, Mel. I do love your book and the High Five Habit, things like that. She talks about, like, I love that she talks about money. And I love that she talks about, like, yeah, like I am a past lawyer and now I'm a, mindset coach, I think is what she calls herself. She's a helping coach, wellness coach, whatever. She talks about psychology And I'm like, okay, so she might be reading these self-help books, or maybe she's studying it, or maybe she got her own mentor or coach or whatever. But she's literally getting paid $100 grand for speaking gigs. $100 grand. Her background is being a lawyer. And so it's like, therapists, like, you can do that too. You can charge $100 grand for speaking gigs if you want to, or be like, yeah, no, if you're paying this lawyer or this person or this celebrity who does not have X amount of years of like education and my credentials, put it out there. You can say, no, I know my worth. And that's one of the big things for me personally. I know a lot of people want to be able to work with me, and they're like, oh my God, what I think you're doing is so cool, blah, 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 blah. And then they get like sticker shocked by like, wow, these are your rates? Like, you're expensive. And I'm like, well, I paid 15 grand more than the average therapist for my education with sexuality and all of that different work. And people don't realize that and know that. And honestly, sex therapy is something, and sex coaching is something that is so niche that when you Google how much does a coach actually cost, and the high end is $150, well, they may or may not actually have a master's degree or be in the field of psychology. And so you're gonna, if you want the cream of the crop coaches or therapists, or have that lens and turned into a coach, right? They're gonna be very ethical on how to help you and to give you different types of recommendations and tools to actually work with. And so it's so niche, and it's expensive because of that. Because think about it, if you're going to a cancer doctor, that's expensive, that's niche. You're going to a diabetic doctor, that's niche, that's expensive. You're going to a naturopathic doctor because that's what you want, that's a niche, that's expensive. So if you're willing to pay for all of those things for your physical body, I think it's so important to think about your mental wellness, your mind, your mental health, as well as your sexual health and wellness too, because that one gets missed a lot. So that's a big one. And we were talking before this about wellness companies and bringing in, you know, a therapist to that. And I was like, well, do they talk about sexual wellness, Poiab? He was like, no. I'm like, no, they need that, because you can't talk about wellness without sexual wellness. You can't talk about relationships without sexual wellness. Like, we need to start talking about this. You can't talk about self-care without sex. And it's so important. And literally, that's why I have my sexual self-care oracle deck, because it's not just about sex. It's also about intimacy and pleasure and learning how to be with yourself, love yourself, date yourself, show up for yourself. So that way, when you are with a partner, and if you decide, or partners, whatever your relationship looks like, right? You know how to advocate for yourself and your sexuality in partnerships and relationships. So, mic drop.
Well said, Jackie.
Any final thoughts on this one?
You know, I think it's a great topic, and, you know, some therapists are not ready to hear this, and I know that other therapists are just clapping their hands, saying, you know what, you two are...
Leave us a clapping emoji if you like this in the comments below.
You know, it still feels very taboo, and we're not making this taboo. It's like, it needs to be said. And you and I are the perfect people to talk about this. So thank you.
Absolutely. I agree 100%. If you are watching this, if you like this, agree with this, got anything out of this video, hit that subscribe button, hit like, do a clapping emoji if you would like below. Thank you for supporting us and this channel too, Boo. We love that all of you are here. And signature sign off.
Own it.
And stay shameless.